Good evening and welcome everybody on this beautiful summer afternoon. The sun shining and the blue waters of Seneca. So crisp and clear here. Thanks for joining us. For those of you who are on this call and think you're on the board of directors call, that does not start until 6 o'clock. All of you that are here now, this is the new member director orientation, and it's for new members or people in new positions or for people who have just never come to an orientation at the consortium. So we're going to try to keep it within an hour so we can break and then go off to the board meeting. And feel free to interrupt me along the way, but we'll also leave time at the end for questions. For those of you who don't know me, I am Elin Dowd, the Executive Director of the Greater Tompkins County Municipal Health Insurance Consortium. Most of you on the phone, on the Zoom call, are directors, but we also have some other staff-related people with us today. Michelle Coco is our clerk of the board, who's admitting everyone and sending you all the spreadsheets. We also have Jessica Hobart, our principal accountant, and she's the one who bills you every month and makes most of your plan changes for your employees. Some of you do that on your own. We also have Don Barber, that many of you met in your new member application process, or have known him for many years, like the rest of us, as the person who helped and found the consortium, began the consortium 10 years ago. So we'll talk a little bit about that later. So welcome. What we're going to cover first is who is the consortium? What are we? Then we'll talk about the role of the board of directors. We'll do a quick financial summary, and then we'll talk about next steps for those of you who are just joining, what you can anticipate in the next day, in the next week or two. And then we'll also at the end our contact information. So if you have any follow-up questions, you'll know who to call and where to call them. Okay, so we'll start with who is the consortium. If you've wandered on our website and you've looked at our background, you will have probably found our mission and vision. There are several important things highlighted in both our mission and vision, but our mission really is we're an intermunicipal cooperative that provides high quality, cost stable health insurance for our members, their employees and retirees. And a lot of times I like to say we're affordable healthcare, but affordable healthcare is a really, really relative term. Cost stable is what we're really angling for. Many of you have been out on the open market, know your premiums go 1 year, they're 15% increase, the next year you're 3%, then they'll go up 12%. It's very hard to predict for your budget year to year. We want to be cost stable. We have several things in place to keep us that way, and we'll cover a few of them in this meeting. So that's our mission. But if you look at our vision of what we're hoping to accomplish, we show who we serve, our friends in Tompkins County and the 6 contiguous counties. We want to provide health insurance plans, a menu of plans for you and your employees and retirees, but we're collaborating with administrators and other providers. We're trying to control costs, be efficient, successful for you. But at the end of the day, we want you to trust us. We want to be responsive. We want to be an efficient vehicle for you to access these products. We also want your members to become more directly involved in their own personal health, which brings us to our last bullet point, where we want to build a culture of preventative health care and well-being for all our members. So if you went through the new member process, we talked a lot about Article 47 and how we are organized as an insurance organization. So Article 47s are considered a self-insured community. So we are self-funded and self-insured, and we are the insurance company. I know a lot of your employees think their insurance company is Excelis, or those, when you come over to us, they will still think it's Excelis because their ID card says Excelis. But we are the health insurance organization. The premiums come to us. We hire TPAs to pay the claims and to give us a provider network. But we are at the nucleus, the health insurance organization. And Article 47 allows municipalities, regardless of size, to pool all of their resources together. So we have members that have 1 employee, and we have members that have 750 employees and retirees. So we run the gamut here. Our municipal partners are considered owners. You're an owner within this health plan, and we write our own benefit plans. Our benefit plans look very similar to other plans offered by Excelis out on the market, but there's a reason for that. And that is, so when people come over, they're comparing apples to apples, and they're not trying to figure out what kind of plan we're offering. But we do write our own benefit plans, and we'll get into that a little bit later in the presentation. There are a couple things we have to do as an Article 47. We talk a lot about the MCA. That's our Municipal Cooperative Agreement. You've all been asked to sign it, to send us the resolution and the signature page regarding the Municipal Cooperative Agreement. It is on our website. It is kind of our governance, articles of incorporation or governance, and we must file that with the Department of Financial Services. Department of Financial Services under Article 47 also make sure we have a surplus reserve and an IBNR reserve, and we'll talk about that a little bit later. We're also required to have stop loss insurance in place. Every member has a voting seat on our board. There's also a role for labor on our board, as well as a role for labor in our governance structure. And we have to comply by submitting quarterly and annual financial reports to the New York State Department of Financial Services. Those are kind of all of our requirements of being in Article 47 and what makes us a little unique and different as a self-funded, self-insured company. So our membership, we started within Tompkins County, hence the name, and then had the 6 contiguous counties join us. And we now have representatives from all those 7 counties. But in addition to that, when we updated our MCA for 2021, and we have to update our MCA every 5 years, I guess whether we want to or not, well, we at least have to review our MCA every 5 years. So 2020 was the 5th year. We needed to amend it and look at it. And we felt it was important at that time to expand our territory because we are getting requests from towns just outside our borders. So with that, we asked the Department of Financial Services to include 9 more counties. So we added Broome, Shenango, Madison, Onondaga, Ontario, Oswego, Steuben, Wayne, and Yates to our territory. We are still pending certificate of authority. They allowed us to put it in our MCA, which we think means they will approve our certificate of authority, but we are waiting for that to happen. I just contacted them today to see how much longer before we hear an answer from them, and they still haven't responded. The last time I wrote to them was right before Thanksgiving. So I guess they're busy. In 2021, we will have 49 member municipalities. So 6 of you are joining us next year, and that will bring us up to 49. With the addition of the 6 new members, we'll probably have about 6,500 covered lives, depending on how many families come on and how much single coverage, but we anticipate it's going to be around that. So we're getting rather large, but manageable. So when I put this organizational chart up, I think everybody's first response is, holy cow, that's a complicated organizational chart. It's not that complicated, and I'll walk us through it. But this really is our organization and how we operate and the resources we use to run the company. We're obviously governed by our board of directors, so our board of directors are up on top. In the board meeting following this, we will hopefully be approving new bylaws. Those bylaws will be allowing our executive committee directly underneath the board of directors to act throughout the year with administrative responsibilities, policy, approval, and implementation, and to keep business moving along, because we're becoming such a large board that this is more of an executive committee to keep us moving along. And it's very similar to some of the organizations you belong to, like NYMER, where everybody is a member of the board of directors, but there's an executive committee that keeps that organization moving forward. So we have just a few staff members. Our clerk of the board does report directly to the board, but there's a nice, that's really a dotted line over to the executive director. And Michelle and I work very closely together. Currently, we are the only 2 staff members. We're hoping this evening we will receive approval to hire 2 more staff members in 2021, a finance manager, and then eventually a benefits specialist. And then that would complete our team. So up there, that's all of our staff. Then right under the executive committee, and really the meat and potatoes of the organization, is because that's where the work gets done, is at the committee level. I'm going to start on the right with the nominations and engagement committee. Nominations and engagement, obviously they put together a slate of candidates for the executive committee, our slate of officers that we will be approving every year at our annual meeting. The nominations committee has taken on more responsibility this year, and that the engagement component of their committee is to make sure that all of our new directors, all our directors are able to engage in the organization and find a role for themselves, either on a committee or in some other way, assisting us with advancing the mission of the organization. So that's the nominations and engagement committee. Claims and appeals committee, they look at any problem resolution needed with claims adjudication. We had a big one this year. And then any appeals that are filed. And luckily we have very few appeals filed through the consortium. It usually goes to our TPAs first. They find the error, they correct the error. But sometimes there are benefits that aren't included in our plans that people want to bring to our attention, and it would go through the appeals committee at that point. Our operations committee was newly formed in 2020, and that handles personnel, policy development, any of the day-to-day responsibilities, and you'll see several things come up before the board this evening. They were very instrumental in putting the staffing plan together with me. Audit and finance, our financial audit that happens every year, as well as monthly, looking at all of our our balance sheets and profit and loss statements and our claims and premiums coming in. All of that is looked at the Audit and Finance. That is the committee that meets the most. They meet monthly. They're a pretty active committee, and we use a lot of our outside resources for them, our auditors, to help us put together the annual audit, but also to help us with our jurat reporting to the Department of Financial Services. Everybody asks us to report just a little bit differently, and the Department of Financial Services with our quarterly and annual jurats are very, very specific. So we have a lot of people assist us in putting that together. And then the Joint Committee on Plan, Structure, and Design is the one committee that the Department of Financial Services recommends or mandates that is part of our MCA, and that we have labor involvement. So you'll see two boxes coming off at the end. Each member has a management member that is allowed to sit, is welcome to sit on the Joint Committee. Some of those management members are directors, some are benefit clerks, some are just bookkeepers, not just bookkeepers, are bookkeepers that pay our bills. Don't have anything to do with the benefit end, but have more to do with the financial end. So it doesn't have to be the director, but we would like a management member involved in the Joint Committee. In addition to that, each collective bargaining unit in your municipality has one seat on the Joint Committee. So there's labor representatives, and those labor representatives select the chair of the Joint Committee and then select the labor seats on the board. And we currently have 6 labor seats on the board. So we have 54, if my math is correct tonight, we'll have 54 board seats next year with, 54 with the addition of our new members this year. So that's the committee structure. And with our new format next year with less board meetings, it's really important that our directors who want to be involved find themselves to one of these committees and chat with Ed Fairbrothers on the nominations committee on how you can get more engaged and more involved in the organization. So on the bottom, on the left-hand side, the grayish greenish boxes show all of our support services that are contracted each year. Tonight at the board meeting, you'll see many of these contracts coming through because this is the meeting when we approve everybody's contract for the next year. But the two on the left-hand side are Losey and Cahill. Steve Losey has been involved since the very beginning of the organization and has been a great plan consultant for us. Knows Article 47s, works with other municipalities, works with other school districts on their health plans, and has been great at introducing us to some of our other partners, our TPAs, and helping us with our RFPs on the open market. Don Barber, we spoke a little bit about earlier, as the founder of the organization, remaining involved as a consultant. And then the various other professional services that you'll see later at the board meeting. On the far right are third-party benefits administrators. And as I mentioned earlier, we have a contract with both Excelis and ProAct to be our to adjudicate our claims. So Excelis is the medical side and ProAct is the prescription drug side. We'll talk a little bit later for our new members. You do get 2 ID cards. One ID card is for Excelis and one ID card is for ProAct, which may be new for your employees. So Excelis is our provider network. If your employee is receiving services through an Excelis provider, they're going to probably use the same provider next year as well, because the Excelis network up here is the same. ProAct, regardless of the pharmacy you go to, you will probably find They are a ProAct provider. ProAct, there's maybe less than 1% of small pharmacies that are not a ProAct. A ProAct is very much about small family-run businesses because Kinney's owns ProAct, and that is a family-owned organization. So most, CVS, Walgreens, Wegmans, you name it, are all part of the ProAct family. So when people say I'm a member of Excelis, they're my insurance provider, they're really your third-party benefits administrator. All right, what are your roles on the board and within the organization? So the board of directors as a whole sets the annual budget each year. They determine the premium rates, they accept new members, they approve new members, they approve new plan design. We'll talk about that a little later. They elect the executive committee, the members of the executive committee and our slate of officers as well. It's the role of the board to ensure fiscal soundness and prudent operation of this organization. As directors, we're expecting you to report back to your legislative body because you are the owners of this organization. So reporting back to our owners is key. And we're hoping board of directors become involved at the committee level. Board of directors' role in setting premiums. You're like, wait, how am I gonna, set a premium? I don't know anything about health insurance. We go through a long process each year, and every year you do it, I think you become more and more involved, more and more informed about how these decisions are made and what are the important pieces that we need to know in discussing premium increases each year or setting the premium each year. So there are paid claims statistical trend models. So we look at our own trends, how are we currently trending with our claims? This year we were trending downward due to COVID, but where we've been trending in the last couple of years has been 5 to 7% upward trend each year, a little bit higher in prescription drugs due to the escalating costs of prescription drugs. But 94% of our expenses comes from paying claims. So that's a really big part of our budget, and that's why we spend so much time looking at claims throughout the year and claims modeling, trending. We look at administrative overhead. We'll talk about how low that is in a slide in the future. We look at our other insurance costs. Tonight we'll be improving our stop loss insurance and our directors and officers insurance and some of the other EPLI insurance we need to have in place. And then our taxes and fees, some are part of the Affordable Care Act, some are just the regular course of doing business. We also then, after we kind of look at all that claim side of it, is how much money do we want to have in the bank? We determine our level of reserves, what kind of liability we will have and adjust accordingly. And then we look at our expenses, how much we want to have in our reserves, which we should be preparing for, and that predicts what income we need to run the business. 96% of our income comes from premiums. So it's basically premiums are coming in the door and they're going out to pay claims. So we'll show you two models in a minute of our claims expenses and our premiums. It's a really straightforward business. I think of my entire professional career, this is the easiest financial spreadsheets I've ever been involved with, because it's really money in the door and money out the door. There's not much more going on within the organization. And then we make adjustments based on benefit design. If we're adding a benefit, there may be an increase in premium. If Excelsior ProAct or Losi and Cahill are advising us that they're seeing something in their database that we should be aware of and adjust, We make that as part of this whole process and part of the premium. So it's a really key role for our directors to become involved in this process. And we try to communicate as effectively as possible as we're going through it. So when you do come to vote, you're aware what has made us make the recommendation that we are making. Next year, we will do a pre-budget approval meeting in August to discuss all these things. And then at the next meeting in September, we will approve them, or we'll put it up for approval. So as a director, what role do you have in benefit plan design? So kind of the straight arrow is the Joint Committee, and it's the Joint Committee on Plan Structure and Design. They make recommendation changes to the board. The board approves the changes, notifications are made to the covered members, changes are coordinated with Excelis and PROACT, and then plan changes are usually effective January 1st. So that's sort of the chain of command in approving. So what are the things we're looking at when we are making benefit plan design changes? Now we have a presentation on how the actuarial value calculations are made as part of the Medicare health system. I'm not going to go into great detail on that tonight. We'll talk about it very briefly here, but when it comes time for us to look at that again in the Joint Committee, we'll do a refresher course on what actuarial value is and why it's important in plan changes. But all of us, Excelis, anybody else in the open market, especially those with metal level plans, must look at the actuarial value calculator that comes out each year from MCS. And we need to audit it and look at where we are in relation to the standard deviation range. And if we deviate more than 2% on one end or the other, suggestions are made to change our plan. So Medicare comes out with this spreadsheet. It's this huge spreadsheet that's a calculator. You plug in all these different numbers. Thanks to Losi and Cahill, they do that for us. They report to the Joint Committee on where we feel we are. But for those of you who want to do your own calculations, usually around March or April is when those calculators come out, and you can pull it off the website and do your own calculations. I prefer to let Losi and Cahill make sure they're working with Excelis to put in everything. And then we report back to the Joint Committee where we are, and we make suggested changes. Usually the changes are made in the deductible and the out-of-pocket maximums, but copays and premiums play a factor in the whole calculation. That is then presented to the Joint Committee. So the calculations are made, we look where we are, if we feel we're in the right range, we leave it. If we feel we're outside the range, we need to make changes. In 2020, we made changes to 3 plans due to the calculator. You'll notice that when we make plans changes to our deductibles, usually in the metal level plans, you'll see Excelis making the same changes. Our deductibles always hover around the same amount, and usually our out-of-pocket maximums, unless there's a huge disparity in how our copays are paid. So that's a big complicated process, and we'll give you more feedback on that later. But then the Joint Committee looks at recommendations that the executive director and our plan consultants bring to us. They're usually bringing information market data, especially when we do new member presentations. A new member will say, hey, we currently have eyewear covered, you don't have eyewear covered. Hey, how come hearing aids aren't covered? And then we put it into the process, or Excelis is telling us they're seeing a trend, and everybody's now covering I don't know, acupuncture or something like that, we better put it in our plan. We take those recommendations, we bring them to the joint committee, we put a price tag on them to understand how premiums would increase as a result of adding that. But we want to make sure we're remaining competitive in the marketplace so that when you're comparing pricing, you're comparing apples to apples, but also we really want to offer the best value to our members. So we want to make sure we have the benefits available to you that your employees are coming to you for and asking for. We also bring to the joint committee any government mandated changes that are required. Usually they come with a price tag. So we always want to make sure the joint committee is aware that though we don't have a choice in confirming and advancing them, that we are able, that we should look at the cost that comes along with them and how do we adjust our plan accordingly. All right, so that is sort of roles and responsibilities and some of the more complex parts of our committees and the role that you will play going forward in those committees and with those responsibilities. So just a quick little financial summary of where we currently are. So we talked about this model a little bit earlier, but all of the blue there represents our income. And like I said, very simple and straightforward. Premiums are where our income comes from. 96% of our revenue is premiums from our members. We get a little interest from our investments. We do receive a nice chunk of money on our prescription drug rebates. If we ever hit our stop loss deductible, we would get reimbursed for that. We have some finance charge income related to our investments. And that's it. So that tiny sliver of pie there is everything else that comes in. But as you can see, it's really premiums that are what is important to us and where our income comes from. This chart looks very similar to the last one. It represents our expenses. So this is up through the end of October. Our expenses, our paid claims continue to be around 94%. So that means majority of those premiums coming in are going directly out to pay claims. We have some fees, our TPA fees to pay our claims, represent that other sliver down below. Some stop loss insurance that we need to purchase, taxes and fees that you can't avoid, professional services, all of those greenish gray boxes on the lower left on our org chart, and then the orange boxes up on the top, staffing and insurance related to staffing. So as far as true administrative expenses of consultants and employees, it's less than 2% of our total expenses. And if you know how insurance companies get dinged in the public market, it's because they have huge administrative fees. That's kind of been controlled under the Affordable Care Act, but we could probably have at least 10% more in administrative fees than we currently do. So that's what makes us such an efficient organization and helps us to control your premiums going forward. There's not a lot of adjustment having to be made for administrative fees. The other thing that's great about our organization is we are well funded. We are very stable and very strong. And I'm sure you've heard about some other consortiums that are not as stable. Their rates aren't as stable as our rates, is because they don't have a slide like this that they can show in a fund balance like ours and aren't as heavily reserved as we are. So the green line at the top, so this was the end of 2019. And I'll let you know where we're going to end up. It'll look very similar at the end of 2020, just a squeak bit higher. So our fund balance, we were actually hoping to take it down a little bit this year and use some of our fund balance in a premium holiday. But due to non-elective surgery being postponed, or elective surgery being postponed, non-essential surgery being postponed, our claims were much lower than we anticipated this year. And with our prescription drug rebates, we think we'll end a little above budget when we thought we were going to be using up some of our reserves. So we're going to end the year, this green line will end the year at 17.9. We're almost at 18 million. And then all of these lines down at the bottom represent our reserves, and total those reserves will end up around 17 million, 17.1. And I'll let you know what each of those reserves are. So the red line is a government mandated reserve. That's our IBNR reserve. The IBNR represents 12% of our estimated claims cost. So we have that every year at the 12% rate. The next statutory reserve is our capital surplus, and our surplus has to be 5% of our premiums. So those are the two that are mandated, and we are audited on each year to make sure we are reporting those reserves. But the consortium is pretty conservative, and we put in a rate stabilization reserve, I don't know, like 8 years ago, I think. And our rate stabilization represents 7.5% of our claims expense. And that's what keeps those premiums between that 4 and 6% increase level. Or it's there in case there's a year we would bump up, we could still maintain that stability. And then recently we put in a catastrophic claim reserve at 4.5 million. As we started taking on more risk with our stop loss, we felt it was more important to have funds in a catastrophic claims reserve. So we keep that funded at the 4.5 million level. So those reserves are there. We report on them every month in our audit and finance committee meeting, and they're always posted, so you can see that we continue to remain a strong organization, and that we do throughout the year. And we have, when we put together the budget, these reserves are elective reserves and the level of fund balance, which we're trying to get down to about 18% of our expenses. Actually, 18% of our premiums we're trying to keep in that fund balance, where we're up around 30% right now. So we can bring that down a little bit, and we have a plan for doing that over the next few years. That's our quick financial summary. You will see more details on 2020 at the board meeting. Next steps. For those of you who are new members, what's going to happen next? Changes are made, most are made electronically, and we are fortunate that all of you this year that are joining us are currently with Excelis. So Excelis electronically transfers your roster and your benefit levels to the consortium. So we get a copy of your roster. In addition, they send an electronic file to ProAct regarding enrollment. So ProAct knows who all your subscribers are and whether they're single or family, and if any plan changes were made. So we do have some municipalities this year switching plans. So those plan changes are electronically moved by Excelis. They'll take your whole group, they'll scoop it up, they'll move it to the new plan that they built behind the scenes, and then they'll send your file to ProAct. So ProAct always lags Excelis. So if there's new ID cards, Excelis ID cards will come out first, and then ProAct ID cards will come out after that. We received the invoice from the roster from Excelis, and that's how we create the invoices. So that's how Jessica bills you each month. And Jessica is going to remind you, your benefit clerk or your bookkeeper, pay your invoice as it is sent. The reason we do that is we have to pay Excelis as Excelis sends us the invoice. So dollar for dollar, we ship money to Excelis based on the invoice. It's the next month that any adjustments are made. So if the adjustment isn't made, if the data entry was put in too late before the invoice was created, Jessica usually knows of the change because you've sent that change through the portal to her. She will make sure and look for that adjustment on the next invoice. But of course, if you see anything on your invoice that is inaccurate or correct, even though you're paying the full amount, you should notify Jessica of what adjustments need to be made. So you should have your first invoice by now. I know Jessica was working on them and sent them out. And if there are any adjustments of people who are dropping off your plan or adding coverage, that will show up in the next month. Jessica tells me that the first couple months are always rocky because that's when we usually have all the adjustments. But communicate with Jessica and she'll communicate with you and we'll get those changes made. I'm going to encourage you to use our website. There's a lot of information on our website that you can go to and become self-sufficient. But if you can't find it, call me and we'll go on the website together. There will now be a portion of the website that says online enrollment. When you go to online enrollment, your town will show up. If you click on your town, that is your personalized application. It's an Excelis application, and that's how you make any of your changes. And it's always there, so you don't have to worry about where it is in your file. It'll always be on the website. You can click on that, have your employee fill it out, and then on that same link are instructions on how to upload that information through our web portal. Anything that goes to the web portal will go directly to Jessica. Of our 6 new municipalities, Owego is the only municipality that is doing data entry directly to Excelis. So Owego is the only location that will be not using the web portal, but sending information directly to Excelis. Otherwise, it comes to us, we input all the data, and then it goes through the cycle to Excelis from us. Also on the website, and just to let you know, we're still in the process of updating the 2021 summaries because we have so many members and each of you have a different plan and we try to personalize it for your location. All of the benefit summaries will be posted under plan information by municipality. So if an employee clicks, they see plan information by municipality, they click on their municipality, there's the summary benefit sheet right there, where that's what you can utilize to give to your employees when they're asking about what kind of coverage they have. When we change our premium equivalent rates, we post those rates on the website. You'll hear about it at the board meeting. We'll also send some information out to you and your benefit clerk. We now have it broken out in different ways where you can see what the increase is going to be by municipality, also by plan. So we update that every year. So if your board is getting wacky and they say, we currently have the bronze plan, but we want to offer the platinum plan, does anybody have any idea how much more that will cost us? You can go on and look specifically at metal plans and it will show you the difference in premiums. You can also always call me, and I'd be happy to provide you with that information. Also on the website, if you missed a meeting, you want to know what the Audit and Finance Committee meeting was doing, or the Operations Committee, all of that information is on the website. We have archives, we have the minutes, we have the upcoming agendas, all on the website. So if you can't find it in your email, and Michelle and I are already on the Zoom meeting and can't reach us, usually you can find it on the website. You'll keep all of our financial reports there, including our DFS reports and our annual audit. And then there's a ton of other information regarding Excelis, regarding ProAct, but some of the most employee user information is found in our newsletters, and we post all of our newsletters on the website as well as all the wellness programs and information that we share. So there's a whole host of information on the website, and if you're ever snowed in and you're looking for something to do, just move around our website and become familiar with it, and help your employees move around that as well. Okay, for those of you who are new, what do your employees need to know? They need to know they're going to get 2 ID cards, not 1. The ID cards are an Excelis ID card with all of their plan information, their new subscriber number, and 800 numbers and things like that, what plan they're on, the name of the plan they're on, and they should give their medical provider the updated information, or they'll be told they don't have coverage. And the second card is the ProAct card. Just so you know, in case you're ever in a pinch and you need to help an employee out, if they are at Walgreens or CVS and they don't have their ProAct card, if they give their Excelis subscriber number, actually just the numbers on their Excelis subscriber number, the pharmacist should be able to find them in the ProAct system. So those 2 numbers they'll notice on their card are the same, but they will get 2 cards. And as I said, Excelis will come first, and then ProAct will come first. Your changes are happening on a holiday weekend. We have a long, the 1st is on a Friday. So, technically we're out of the office from Thursday till Monday. So make sure that those that have prescriptions that they need over that weekend, that they fill them in advance, or remind them to fill them in advance. We don't anticipate there's going to be problems, but if something's going to happen, it's going to happen on a holiday weekend when your plan is changing on January 1st. So please advise them to fill their prescriptions in advance, especially those that they need on a regular daily basis. Speaking of prescriptions, because everybody was on Excelis, Excelis is moving prior authorization information over to ProAct. So that means if someone has a prescription that they needed a prior authorization for, and that prior authorization lasts a year, they won't have to get it renewed on January 1st. So let's say they had a prior authorization approved in September, that approval will come over so they can keep filling that prescription, and they won't have to get another authorization until next September. So that information is moving over. So hopefully all of that will be transferred. If there's a prior authorization currently in the works, that may not transfer over because it depends when the file feed came through, but we're hoping all of them will transfer over. Both Excelis and ProAct have 800 numbers. So if somebody wants to know what their coverage, am I covered for this or am I covered for that? That's always the first line of defense. Have them call the 800 number. You can call it with them or ask them to call it. The Excelis and ProAct customer service representatives should be able to pull up our plan descriptions and let the employee know yes or no, whether it's covered, or help them secure the care that they need most effectively, especially on a weekend. We already talked about provider networks, that they are the same for Excellis, and that the major pharmacies are all included in the PROACT network and then some. There shouldn't be much concern about, going to the same doctor. The one thing I also encourage employees to do, if it's a holiday weekend and their kid has an ear infection, because that's when every kid gets an ear infection, is on the weekend, especially a holiday weekend. Telemedicine is available to them day one, but they have to go on to the Excellis website to sign up for telemedicine and to call in for telemedicine. So they can call the 800 number, the 800 customer service folks will walk them through it, or they can go right online to the Excellis website and log in with their new subscriber number and have access to telemedicine. So that's something they may want to know about before the long weekend. The last bullet point is an additional little benefit in our prescription drug category for people with maintenance drugs that we can secure cost effectively and safely through another country, usually Canada. They can sign up for a mail order program. The prescription has to be written for 90 days supply. The information regarding CannaRx is on our website, and we'll talk more about CannaRx throughout the year. We'll send out flyers reminding people that we have this benefit. But CannaRx costs $0. So if you're fortunate enough to have your maintenance drug on the formulary, then you can secure that maintenance drug through the mail order CannaRx program at no cost to you. So that's a little additional benefit there. So make sure your employees are looking for that as well, especially those with expensive maintenance drugs. Okay, so anything we didn't cover this evening, feel free to call any of us. I don't put specifics next to my name because you can call me for anything. I do want to let you know though, this number rolls to my cell phone. And if I'm not in the office, I do answer my cell phone. But if I just happen to not get your call, I will call you back from a California cell phone number. So if you are waiting for a call from me and you see a California call come up, it's not a telemarketer. It's probably me out of the office calling you back. But if you call this number, it rolls straight to my cell phone. So even on a holiday weekend, I will have my cell phone with me and you'll be able to reach me that way. Michelle Coco, who's now handling all our administrative responsibilities and any board related questions, how to get your Zoom information, how come you're not on the distribution list, please contact Michelle. Probably the best way to get Michelle is through email. Her phone number is her landline, where she currently resides at Tompkins County. So easier for you to email her through the consortium, and she is very responsive, especially at 11 p.m. at night. So if you want her after the board meeting, the chances of her responding to an email at 9 o'clock at night are much higher than me. Also better to reach by email because this is also Jessica's landline at Tompkins County. Is Jessica, any questions on invoices or any questions on employee changes, email Jessica or give her a call at that number. So that's how to get in touch with us after this call and tonight's meeting. Feel free, if there's anything regarding your transfer of healthcare from one organization to another, we're all here to help you and to serve you. So don't hesitate to call. So with that said, feel free to unmute yourself and let me know what kind of questions you have this evening. Nothing? I'm looking around. I don't see any hands raised. I know what we're all thinking. We're all thinking we have to log in a half an hour for the board meeting, and we need to take a bio break and get a snack in before we do that. But if you do have any questions, I'm available. Don Barber is still available to all of you new members. We'll try not to bother him as much, and instead let myself, Michelle, or Jessica know how we can serve you, best serve you, and get your employees the health care that they need when they need it. So if there aren't any questions, we will log off from this call, and in a half an hour, there is a different login for the meeting. So please, please make sure and log in then. Michelle would appreciate it if you logged in a little bit earlier, because there has been some hacking on Zoom, and we now need to admit you so our meeting isn't interrupted. But thank you for spending this hour with me, and I look forward to spending some more time with you later this evening.
Thank you, Elaine.